Hi and Assalamualaikum. Thank you all for finding time and visiting today's webinar about mental health. You will make your way out. Okay, let me introduce myself first. My name is Wana Syafiqah binti Wan Muhammad Ghazali from Bachelor's Degree in Psychology, Sultan Idris Education University. I'll be responsible for hosting this webinar today. Okay, according to our topic about mental health, you will make your way out. Let me explain about what is mental health. Mental health is an important part of our life of a person. It impacts our behaviors, emotions, and thoughts. A healthy mental state promotes effectiveness and productivity in activities that includes works, academics, and interpersonal relationships. Now I would like to welcome you all to this beautiful with brain panels. Our first panel is Dr. Tan Yen Yong, Psychiatrist at Hospital Bahagia, Tanjung Rambutan. Hi Doctor.
Hi. Hi.
Move to our second panel, which is Dr. Fitra binti Badlisha, Psychiatrist at the Ministry of Health Malaysia. Assalamualaikum Doctor.
Waalaikumsalam. Thank you for inviting me.
Next, our third panel is also psychiatrist at KPJ Johor Specialist Hospital, which is Dr. Nurul Ailin Mazun binti Mazlan. Hi Doctor, Assalamualaikum.
Hi, salam. Thank you for inviting me.
Welcome. And last but not least, our last panel, look shy but speak fluently, Dr. Farah Nadira binti Muhammad Zuki, psychological therapist at Hospital Raja Perempuan Zainab II. Assalamualaikum Doctor, welcome to our webinar today.
Waalaikumsalam. Thank you.
Wow, it appears that today's our panelists are all highly educated. So today's webinar has the potential to inspire a lot of people because of our panels are all excellent and specialized. Okay, let's start our webinar with our first panel, which is Dr. Tan Yen Yong, who delivered the presentation on topic depression. Please welcome Doctor.
Greetings and hello everyone. First of all, I would like to thanks to the organizer for inviting me to this amazing webinar today. Also, I would like to thank to all of you for making your time to join me and the other panels today. My name is Tan Yan Yang. I am a psychiatrist at Hospital Tanjung Rambutan, Hospital Bahagia Tanjung Rambutan, sorry. And today I will be presenting about depression. So first of all, I have a question to all of you. What is the highest age that are diagnosed with depression? So the answer is 18 to 29 years old and followed by 45 to 64 years old, 65 and over, and lastly is 30 to 44 years old. Moving on to the next slide. What is depression? So depression, or known as major depressive disorder, is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable, so do not worry. Depression causes feelings of sadness and or a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. For your information, more women are affected by depression than men. Depression can lead to suicide, and there is effective treatment for mild, moderate, and severe depression. Next, there are a few types of depression, which is major depressive disorder, bipolar depression, perinatal and postpartum depression, persistent depressive disorder, psychotic depression, and premenstrual dysphoric disorder. Next, what are the symptoms of depression? Please take note for this as this is really important for everyone. First, feeling sad or having a depressed mood. Loss of interest or pleasure in activities once enjoyed. Changes in appetite such as weight loss or gain unrelated to dieting. Trouble sleeping or sleeping too much. Loss of energy. difficulty thinking, concentrating, or making decisions, and thoughts of death or suicide. Next, causes of depression. So there is a lot of causes for depression, such as abuse, age, certain medications, conflict, death or a loss or known as trauma, other personal problems, and serious illnesses. So, as I mentioned before, depression is treatable. So, how is depression treated? By medication, psychotherapy, self-help and coping, supplements, food and diet, exercise, and brain stimulation therapy. So, how or where do you refer for depression? I have listed down two as references for you, which is psychiatrists and mental health helplines and resources. I also list down some of the mental health helplines and resources, which is Befrienders, Malaysian Mental Health Association, Lifeline Association Malaysia, and Relate Malaysia. So next, I found this quote on Google, which is, I'll be okay, just not today and probably not tomorrow. So that's all from me. Thank you.
Thank you, Dr. Tan, for the presentation about depression. So we can see the types of depression like major depressive disorder and bipolar depression. And also we can see the symptom of depression. Okay, doctor, I have some question to you. The question is, doctor, can you share with us the most youngest patient that you have treated for depression?
Thank you for the question. The most sorry, can you repeat the question?
The most youngest patient that you have treated for depression?
Okay, thank you. The most younger patient that I have treated so far is a 16 years old student, and I have been treated her for almost 6 months now, and she is under medications and appointment from me. Thank you.
Okay, thank you. Without further ado, let's move to our second panel, Dr. Fitra, with her topic anxiety. Please welcome, Doctor.
Okay, thank you, moderator. First of all, I would like to apologize because my background is not okay. Okay, first of all, Assalamualaikum and a very good evening. Wonderful thanks to everyone, and I hope you can see my slide. Okay, first of all, I would like to welcome and thanks for attending this webinar. How are you guys? Hopefully you guys in the well health condition. Okay, health mental health, you will make your way out. Such a good topic to discuss. Now we move to the second common types of mental problem, which is anxiety. Okay, I'm pretty sure that you guys have been heard this type of mental problem before this, right? Now I will explain more about what are the meaning of regular anxiety and anxiety disorder, and what is the difference between these two type of anxiety and how you want to fight for it. Okay, next slide. Okay, we move to what is the regular anxiety. Okay, regular anxiety is happen when an individual face potentially harmful and worrying triggers. Feeling of anxiety is not really normal, okay, but it is necessary for survival. The nervous feeling before an important life event or during a difficult situation is the natural echo of original fight to flight reaction. Okay, anxiety is about being hit by a car when you want to crossing the street. For example, means that a person will instinctively to avoid danger. Okay, worrying about bills, job interviews, tests, or other important situations are normal feeling. Don't worry, okay? Okay, we move to the next slide. Okay, for the next slide is about anxiety disorder. Okay, what is anxiety disorder? In contrast, anxiety disorder is worrying constantly and excessively for no apparent reason. It's difficult to you perform day-to-day activities. I give you two examples of anxiety disorder, which is you are repeatedly have panic attack along with nervous feelings like I'm going to die for no apparent reason, and the constant fear of having another attack is the situation that someone with anxiety disorder experiencing. Okay, next slide. Okay, now we move to the symptoms. Okay, I'm pretty sure that you guys want to know what is the symptoms of anxiety disorder. Okay, there are a lot of symptoms of anxiety disorder, but the common symptoms are you your heart rate increasing and you have heavy breathing, increase muscle tension, tightening sensation in the chest, or obsessing over needless things, leading to compulsive behavior are the other symptoms of anxiety disorder. Okay, if you feeling of worry or dread uh, have a disabling effect on you over the period of time, you should to seek for advice from the mental health professional. And I want to suggest if you have notice this sign in your family members or your friends, you must to talk with them about the possible condition, and please to advise them to meet the mental health professional. Okay, now I want we move to the treatment. Next slide. Okay, for those have an anxiety disorder, there are so many treatment to make you way out from this kind of mental problem. Okay, this treatment will consist of the combination of psychotherapy and behavioral therapy or self treatment. Okay, first is self treatment. Okay, for some cases, a person can treat an anxiety disorder uh, at, h- at, at home without any clinical supervision. But this may not be effective for severe or long terms of anxiety disorder. Okay, relaxation technique like a simple activities can help soothe the physical and mental sign of anxiety. Okay, this technique can be include meditation, deep breathing exercise, resting in the dark, long bath, and also yoga. Okay, we move to the second treatment, which is counseling. Okay, the standard way to treating an anxiety disorder is by psychological treatment or psychological counseling. Okay, can be include cognitive behavioral therapy (CBT), psychotherapy, or the combination of these two therapies. Okay, CBT is the type of psychotherapy, sorry, um, aims to recognize and change the harmful thought pattern uh, that form the foundation of anxious and troublesome feelings. In this process, practitioner hope to limit distorted thinking uh, and change the way people react to the situation or object that trigger the anxiety. Okay, I think that's all for me. I just want to say that if you have this sign of uh, or you have a sign or symptoms of anxiety disorder, please go check to doctor. It's maybe can give you a bad effect if you do not seek for immediate treatment. Okay, that's all for me. Thank you.
Thank you, Thank you, Dr. Fitra, for the speech. So we know that this disease is very dangerous because it can harm a person by unknowingly acting. The question to Dr. Fitra, Doctor, is this anxiety disorder a hereditary disease?
Okay, thank you for the question. Okay, yes, anxiety disorder is caused by a hereditary disease. I confident with this statement because many of researchers conclude that anxiety is genetic, but it can be influenced by environmental factor also. But in other words, it's possible to have anxiety without it's running in your family. I hope I answering your question.
Yes. Okay. Next, I will pass the floor to Dr. Eileen, who will be speaking to us about dissociative identity disorder. Please welcome, Doctor.
Okay, alright. Hi, Assalamualaikum warahmatullahi wabarakatuh, everyone. Okay, again, I want to introduce myself. Okay, first of all, thank you to moderator. Okay, for letting me to join this webinar. Okay, my name is Dr. Nurain Mazlum Timazlan. I'm a psychiatrist at KPJ Johor Specialist Hospital. Okay, before I start my speech, okay, I want to ask you guys, okay, do you know what is dissociative identity disorder or DID? Okay, maybe you guys have heard the word. Okay, I want to ask you guys again. Okay, how many of you know what is multiple personality disorder or split personality? Right. I'm pretty sure that the most of you know what is split personality is, right? Okay, because we watch movies and drama such as Partner of Justice, Split, Kill Me Heal Me. Okay, there are so much movie presented to us. What is split personality or DID is? Okay, let's make it simple. Okay, DID is a person who have two or more identity. Okay, and the ID is a part of mental health condition. Okay, the ID is very, very rare, but as a human, we cannot deny that this condition was exist. Okay, the ID the ID represent 1% of the Malaysian population. Okay, when we watched a movie, we only saw males who suffer with the ID, right? Okay, but researchers found that the ID is more common in females than males. Okay, why this can happen? Okay, this happen because females face childhood abuse more frequently than males. Okay, people who tend to be abused, either sexual or physical abuse, was easy to suffer with the ID. Okay, then people who have been very chronic childhood abuse will get experience trauma. Okay, this person will reluctant to accept their past, so that they create new identity and throw away their bad memories. Okay, it we as a human, we all have a very, very powerful brain. Okay, so to protect ourselves from the bad memories, our brain creates a new memory and change the person into someone else. Okay, this is how someone detach themselves from trauma. Okay, other than that, we can relate that the causes of the ID is family background. Okay, maybe their parents or relatives suffer with mental illness. Okay, then researchers also found that someone who have a painful life experiences such as uh, parents died during war. Okay, also easy to suffer with DID. Okay, not only people who was abused, but people who have a tough past will easy to have DID. Okay, if you talk about the symptom, okay, next slide, the symptom. Okay, if you talk about the symptom, we know that person with the ID have more than one identity, and the core identity is their real identity and themselves. And they can alter their identity to maybe 10, 20, 30, or maybe 100. Okay, then the new identity can be different in gender, such as today you are a man. Okay, maybe tomorrow you become a woman, or maybe today you love soccer, but tomorrow you love badminton. But the common symptoms of the ID are anxiety, depressions, delusion, suicidal, and memory loss. Okay, when they transform to one another to another identity. Okay, they transform when they remember their past. Okay, they become sad. Okay, then what they do? What they do to forget their past? Okay, they will change their identity lah. Okay, the treatment. Okay, we know that. Okay, next slide. Okay, the treatment. We know that the treatment, right? Okay, we know that some medications help people with depression and anxiety, but person with the ID have to get a treatment. Okay, they really need a treatment. Okay, the most effective treatment is psychotherapy. Psychotherapy, yeah. Okay, as a psychiatry, we will diagnose them first. Okay, then we will identify and working through past trauma or abuse. Okay, then we will managing sudden behavioral changes. Okay, and the lastly, we will merge. Okay, this is a very important part. We will merge the separate identities into a single identities. Okay, and this treatment will take times, but as a patient and psychiatrist, we really have to do this. As a human, we cannot prevent the ID. Okay, but we can seek treatment to manage the symptom. So as a parents, as a friends, teachers, and neighbor, it is our responsibility to help them to get treatment, because person with the ID can be seen since they were young. If you do treatment soon after being abused or trauma, can prevent the ID from getting worse. Okay, so as I can say, the ID has no cure. Okay, the ID has no cure, but I can promise that it can be reduced. It can be reduced by treatment. Okay, that's all from me. I hope you can understand more about dissociative identity disorder. Okay, I pass to the moderator. Thank you.
Thank you, Dr. Eileen, for the clearly explanation about DID. Okay, doctor, I want to know what is the role of people around when they know an individual has a split personality.
Okay, all right. Okay, thank you to moderator. Okay, thank you for the questions. Okay, if you have a family or friends who have the ID, okay, first you have to know what is the ID and the symptoms. Okay, you have to do some research lah about the ID. Okay, then you can consult doctor and ask doctor what happened with your friend, with your family. Okay, then if you know that the person have a symptom of have a symptom of the ID, okay, then slowly offer he or she to attend a family counselling. Family counselling tu you can meet with your family lah. Okay, then you can ask them to doing treatment together with someone who they love, but do not force them to do treatment. You have to do they have to do with someone they love. We can give, as a family or friend, we have to give them love as much as we can, because they really need a love. Okay. Okay, then you have to stay calm. Okay, don't get panic when you have someone who have the ID. Okay, always support them, and the more important thing is you have to be patient. Okay, all right, thank you. I hope I answering the questions.
Yes, very clear. Okay,
Thank you.
let's continue to our last panel, Dr. Farah, to give her speech on topic post-traumatic stress disorder. Please welcome Doctor.
Okay, thank you to moderator. Assalamualaikum and greeting to all the audience. My name is Dr. Nur Farah Nadira binti Muhammad Zuki, psychological therapist at Hospital Raja Perempuan Zainab II. Thank you for inviting me to share about post-traumatic stress disorder, or in the short form, we call it PTSD. I hope you all can see my slide. Next slide. Do you know what is post-traumatic stress disorder? I think some of you already know what is PTSD and some don't. Post-traumatic stress disorder is a disorder that develops in some people who have experienced a shocking, scary, or dangerous event. Most individuals think that it is natural to feel afraid during and after a traumatic situation. Fear triggers many split-second changes in the body to help defense against danger or to avoid it. The response that usually occurs when we are in a scary situation is the fight or flight response that aims to protect ourselves from harm. But it's different for those who continue to experience problems may be diagnosed with PTSD. People who have PTSD may feel stressed or frightened even when they are not in danger. Actually, not all traumatized people experience short-term symptoms, and not everyone with PTSD has been through a dangerous event. Most people who have PTSD will slowly get better. Some experience, like the sudden, unexpected death of a loved one, can also cause PTSD. Next slide. Let's move to the symptom. Symptoms usually begin early, within 3 months of the traumatic incident, but sometimes they begin years afterward. Symptoms must last more than a month and be severe enough to interfere with the relationship or work to be considered with PTSD. The cause of the illness varies. Some people recover within 6 months, while others have symptoms that last much longer. In some people, the condition becomes chronic. There are 4 symptoms of PTSD. First, re-experiencing symptoms such as flashback, like reliving the trauma over and over, physical symptoms like a racing heart or sweating, bad dream, and frightening thought. Second, avoidance symptom. For example, staying away from place, event, or object that are reminder of the traumatic experience, and avoiding thought or feeling related to the traumatic event. Third, arousal and reactivity symptoms such as being easily startled, feeling tense, having difficulty sleeping, and having angry outbursts. Last one is cognition and mood symptoms, like trouble remembering key features of the traumatic event and negative thought about oneself or the world. Next slide. To be diagnosed with PTSD by the psychiatrist or psychologist, an adult must have all of the following for at least 1 month: at least one experiencing symptom, at least one avoidance symptom, at least 2 arousal and reactivity symptom, at least 2 cognition and mood symptom. Next slide. Okay, usually the main treatment for people with PTSD are medication and psychotherapy such as talk therapy, cognitive processing therapy, and prolonged exposure therapy. Medication actually help to stop thinking about and reacting to what happened, including having nightmare and flashback. Everyone is different, and PTSD affect people differently. So, a treatment that works for one person may not work for another. It is important for anyone with PTSD to be treated by a mental health provider who is experienced with PTSD. Treatment should equip individuals with the skill to manage their symptoms and help them to participate in activities that they enjoyed before developing PTSD. I think that's all from me. Thank you.
Treatment and the therapies for PTSD is medication, talk therapy, and so on. So my question to Dr. Farah is, Doctor, what will happen if PTSD is not treated?
Thank you for the question. Actually, PTSD is a progressive disorder that can make the symptom become much worse from time to time. Untreated PTSD can cause serious depression and loneliness. Many sufferers may demonstrate suicidal thoughts. Other than that, anger management issue as recurring stress and anxiety result in outbursts of anger that lead to abuse and public violence. So, my advice is a person struggling with PTSD should seek out a treatment that will work for them to get them on track to managing their PTSD. So I hope I already answered your question.
Okay, thank you again, Dr. Farah and all panels for answering those questions and for the great presentation. It was a pleasure to have you with us. Okay, ladies and gentlemen, finally we come to the end of our webinar. I would like to say thank you again for all our panels for their informative and interesting talk. And to all audience, thank you for your active participation. Hopefully the webinar will be the beneficial for everybody. Thank you for your attention. Okay, now we come to Q&A session. You can ask everything that you want to know about the topic webinar today. Please mention to which panel you address your question. Any question? Please raise your hand.